and welcome to another episode of HR Nightmares. I'm Lisa Leith, and I'm here with Amy Conway and Beth Looney, and we have a really special guest joining us from Marsh McLennan Agency, Kate Valette.
Yes, that's correct.
So I'm going to let her introduce herself a little bit more, but we're really happy to have you here. Thank you for coming the whole way from Virginia to sit with us in the studio today. For those of you who are watching on YouTube, things look a little different. We're super excited. We're going to be in a new studio soon, get a really cool setup, a new modern setup. So we're in transition right now. But this is a more intimate, sort of like talk show situation we've got going on right now.
It's comfortable.
Yeah.
We need like the Roots and some band in the back.
Yeah.
That actually would be awesome. Why didn't we do that?
We need to do that next time. Next time we'll do that.
Yeah.
I'll have to come back for that.
Anyway, we're happy to have you. Usually what we do is we've got a ton of questions for you, and we want to hear about your journey on how you got to where you are today, and then some of the cool new tools that you're introducing at Marsh McLennan Agency. But also, we get some audience write-ins, and sometimes that's the most fun, is you get to pretend you're an HR person for the next 40 minutes as we get through some of those audience write-ins. And what we're here to do is just provide realistic advice with a little bit of humor. For those of you that are listening, we want to thanks for tuning in. Make sure you hit subscribe on the YouTube channel, and tell your friends to listen wherever they listen to their podcasts. Well, let's kick it off. I'm going to turn it over to you, and I'd love to hear a little bit about your background as a registered nurse. You're a Southerner now that came from Syracuse. You graduated from Syracuse. You're from up north. But
up north.
How'd you end up at MMA?
Oh my gosh. Yeah, my mother describes it as a family circus type of career path, but I spent about 20 years as a bedside nurse, clinical, and the majority of that was as a critical care nurse. Most of that was as a ER nurse in a level 1 trauma center, and I loved it, loved every part of it, and really was, during that whole process, always grabbing as much data as possible. And data was just what was fueling a lot of the actions that we did, which is interesting because that's exactly where I am now. So I decided to hop the fence. We moved from New York down to Northern Virginia, and I spent about a couple of years working as a case manager, a nurse case manager, with a small mom and pop organization, working with folks who were injured on the job. And that somehow opened up some doors for me in a corporate setting where I spent 7 years working under a Total Rewards umbrella, and absolutely loved it. We were a team of nurses and non-clinical team members who basically were the first folks for contact for our employees. So anybody who is going through a medical event or having some type of difficulties managing their work-life balance would basically be sheltered over to us so that we can provide support. And it was a growing company through several mergers and acquisitions. We ended up going to about 40,000. So as you can imagine, we had a lot of information. We really learned a lot about how people behaved towards their health and what actions they took or sometimes didn't take that may have led to certain situations that really they were challenged in the workforce. So I loved doing that. It was a great experience. It was my first experience learning about consultants, which is what I'm doing today. And that's where I've spent the last several years, where I've been working as a clinical consultant and helping clients, employers who are really trying to, number one, understand their clients or their population's data and what it's telling us. And then what do we do about it? And how do we mitigate some of that risk that's out there, and of course control expenses while making sure that people are at their healthiest. So really enjoy doing that. The model that we have at Marsh McLennan Agency is absolutely a wonderful, wonderful model. Certainly for me as a nurse, it fits exactly what I'm looking for as far as delivering the services that I can deliver to our clients.
So what I was excited about was all the stories that you must have when I think about just like leave management.
Oh yeah, there's so many things in there.
There's just, God, I was coming up with some stories of my own from back in my manufacturing days. But like, tell us a success story on how your team of Total Rewards nurses and non-clinical people like dealt with a crazy leave management situation. Does anything kind of come to mind?
Oh my gosh, there are so many, of course. But, you know, I think that we used to see an awful lot of folks who were, I think, really not understanding what the resources are. And of course, now sitting on the other side of the table, this is a common conversation that we're having, is that people don't know that we have all these great benefits or point solutions in place to help them manage some of these issues. And I think that I had this one incredible, very enlightening introduction to a employee who essentially, we got a phone call late on a weekend, and they had to do a medical evacuation for this employee and get him back to the States. And he had, they didn't even know what was going on. He was unconscious. They had no idea what the health conditions were.
He was like on vacation?
It was not. He was actually working. He went over to do some contract work. And so, of course, you know, here we're trying to manage that whole, let's get the person back where they belong so that they can get the medical care that they need. And, you know, a couple weeks go by, and I'm talking with the staff at the hospital, and we finally connect and understand who this employee is. Never heard of the employee at all. It wasn't somebody we had been working with. So as time went by and we finally start talking with him on the phone, and I'm essentially working with him to help him understand what his disability benefit was going to be, how that was going to show up in his paycheck, et cetera, what options. It then led to, what options do you have as you start to recover? What had happened was he had really avoided having any type of preventive care. He was in his early 30s. He was not old, but he was a diabetic and did not realize it, and had ignored all the symptoms of having diabetes. So as I was starting to work with this individual, he was like, I didn't even know. I kind of pushed it off. Looking back, it all makes sense. But his blood sugar was so high that he doesn't even remember essentially falling through the ER doors of the hospital where he went into. Had no recollection. So I worked with him for a year, and that person was on disability, then going back. He was lonely. He didn't have connections. He felt very much outside of sorts with his own team, because a lot of the team wasn't centralized. So he didn't have that connectivity that is really, quite frankly, essential. Personal life also had his own struggles, so there was some mental health issues there as well. And he essentially worked a year, ended up losing almost 100 pounds through our well-being program that we had in place, and was incredibly successful, an extremely productive member, because what happened is we started to make connections. We started to say, do you realize that we have employee resource groups in place? You might be a great fit for this. Get connected and start to feel that you do have this family that you work with, and people are here for you. And that particular event really led to the success of him having a very long-term service after a while.
That's great. I'm curious, like, how common it is to have actual experienced nurses and healthcare practitioners transition into roles like these. I mean, I don't really, this is the first kind of thing I've heard about, really, that there would be someone on this side of it from a workforce planning. I'm so used to people going through disability, you know, third party, call here, call them at life.com, you know, all these different things, but I'm not used to it, them getting someone on the other side that actually understands from the medical side of it.
Yeah, and I think that's number one. That's a struggle working with carriers, is that, you know, they're not always necessarily working with a nurse case manager.
Right.
They're usually touching base, whether it's disability or workers' compensation. They're usually touching base with an adjuster, and then the adjuster would, if it's a little bit more complex, that adjuster is going to then loop in the nurse case manager within that particular carrier, and then they might have touch points with that person. And we operated very differently. It was all in-house short-term disability, so we managed that ourselves. It is unique. It was unique.
Yeah.
It was something that, quite frankly, was a differentiator for the company, because they really wanted to put out how high touch they wanted to be with their employees. that they developed this was extremely confidential. It was a place for their employees to go where they can go through their medical issues and have somebody there to connect, but not really be in jeopardy from as far as a business standpoint goes, where they were free to discuss what was going on. They were just diagnosed with cancer. They knew that they had radiation, chemo coming up, maybe some surgery. What do they do? And we talked with those folks from the first point of contact with, here's what to expect with surgery. Do you need to ask your doctor certain questions? This is what we would recommend. If you're going out for surgery, think about basic durable medical equipment that you're going to need when you recover. Who's going to be there when you recover? So it was a great service. I think we really saw that we were able to help folks get back to work because we were already talking about returning to work before they even left on disability. So we were already making those plans for them to get back into that work process and flow.
Yeah, which is such a key because we know
Yeah.
that the quicker employees return to work, especially
Right.
after a workplace injury or something, it's like, get them back in here,
Right.
even if they're doing a very different job or something that we wouldn't even need to have done, but it's
Special
important
project.
for them to be back in
And it's
the
the
environment and the
community.
culture.
Yeah.
I mean, it's just a
Yeah.
known
It's the
factor
community,
that
they're
people
not
heal
alone.
faster when they're around support and they get back into their routines.
Yeah, absolutely.
How
It
do you
is.
deal with, it's interesting, a lot of the clients that I work with are smaller businesses, right?
Yeah.
So there's the confidentiality. You said that that business was a 40,000 person.
Large, yes.
Right, so you could kind of find your way to be anonymous with that. Did you ever have any pushback with that, especially maybe on the preventative care side?
Yeah, that's a great question because I think that there is, with folks who weren't used to us being in that, having that type of service, coming to us from a different company maybe, there was a level of trust we had to build up with them. And we worked with them and we understood that. And I think, certainly as a nurse and in my role and all nursing roles, we basically understand that we're walking into a patient's room with somebody who's very vulnerable. They really don't know. So every single time you enter a new patient's room, you have to establish that trust, right? So we're very comfortable in those positions to be able to have the conversations, let people know that here are the resources, we're here. But we did find that it kind of went viral in a sense, that people would say, oh my gosh, you're going through this, you need to go and talk with this team.
That's when
Yes.
it becomes really successful, when
Yes.
people are advocates because they've gone through it.
That's right. That's
Perfect.
right. And they're like, you can trust them. And that word really spread. And we used to say we're a very small but mighty team, right? Because we were able to function in the capacity that was going to essentially bring these folks and connect them, bring them to the core of the business.
So we had a plant nurse at all the different like Corning locations that I was at, and it was awesome because not only would they be able to help handle leave and get people back on like a return to work program with desk work or whatever if they were production employees, but they would also do like flu shots and all kinds of preventative care. But we had 1,000+ employees at like one of the plants. It's actually a lot more affordable for some of these mid-sized companies to bring clinical, like licensed clinical folks and make them accessible to employees than you would think. So for instance, right now I work in a mid-sized company, but like we're doing an anonymous sign up for employees. We're going to pay for their co-pays, pay for their HSA, whatever HSA would charge them on their high deductible plan. The company's Vanica is going to take care of paying for that. We're going to do a pilot program with 10 folks, and people can anonymously sign up for these like therapy sessions. And I think it's going to be a big hit. Like all the employees that I mentioned, hey, we might do this, they were like, I would sign up for that today. And so we're going to do 30 slots, 30 sessions, make them available, and pay for all the co-pays. But like that is cheap.
For like mental health therapy.
Health, a
I think
therapy.
that's great.
Yeah.
But you could do it with like find a primary care like network in the community where you live, and I bet you they'd be willing to hook something up like, hey, 2 or 3 days a week if you have people coming into the office, we'll send a provider out there for half the day and you just owe us whatever, a couple $1,000 or something. But if you think about, I thought back on all the employees that we've allowed to take leave for something personal related or mental health related in the last 2.5 years I've been working with Vanica. It's more than a handful of people out for more than a handful of weeks. And so, God, the couple of $1,000 you spend on 30 mental health therapy sessions for people, I mean, if you can prevent one person from being away from work for a couple of weeks, it's like the return is great.
I think also there's, maybe because I'm older, haha, but back in the day, I think when I started working, there was a stigma around mental health, right?
Yes.
So you would never, good Lord, tell your boss that you might need some mental health help. But I think as the workplace is changing, younger people are just more open about it. And I think that can be so positive.
Yeah, and you can also we're hooking it up so that we send the link out to our employees, and then they anonymously sign up through the therapy group.
I love that.
So I don't even know. I
think
just
it's
get the bill.
Well, it's about providing the access, and we've talked
Right.
about that on some of even our mental health focused. I mean, it's hard to find
Access is
someone
a
good
huge issue.
that you can actually
Get an appointment with.
afford to
Under
pay
a few
for.
months.
Yes,
Yeah,
under a few
under a
Yeah,
few
and so
months.
it's
Yeah.
kind of more like a lot more people probably would take advantage of the things that are offered in EAP and the 5 visits they get that are paid for maybe on their healthcare plan. But going and actually finding
doing
someone that's good that you can actually have a vulnerable conversation with and feel comfortable with, that's really challenging too. It's not just about having the, okay, my benefits pay for 5 sessions.
Right.
It's the, now I have to make phone calls, now I have to Google, now I have to wait 2 months before someone's available.
And I'm not
then
sure
But when
there's-
it's right there in front of
and you're
you,
making it so accessible, and it is going to lead back to higher productivity, higher performance, better culture, happier people,
Better engagement because you know
Yeah.
that your employer cares about you.
it's that connectivity
Yeah,
again.
they care about you and they want you to thrive.
Yeah.
And
tell
not
you,
just, sorry, you're going
yeah.
through this really hard time. but
Right, right.
Where's the report?
Well,
That's
also
right.
the diabetes thing. I mean, that reminded me, and so many people have diabetes. I mean, is it a pandemic, an epidemic? What is it? It's like, I mean, half the population,
Well,
I feel like. has
right, and look at obesity, right? And that's the U.S. population.
US,
and with
yeah.
obesity, you typically have diabetes as one of those progressive issues. So you have obesity will bring on hypertension, high blood pressure, high cholesterol, and that's a progressive vascular condition which leads to diabetes, coronary artery disease, and then it trickles down where eventually if people either are very complex to manage or they don't manage it, it can lead to your end-stage renal disease.
Yeah.
So that whole tube, if you think of it, of the progressive timeline of those disease processes are very complicated. And all of them, at any point in time, any chronic condition, you will always have a mental health component to it. And it's interesting that here we are as folks in HR talking about how to address the stigma and all of these solutions that might be able to benefit these folks from a healthcare perspective. From Nursing Student 101, we were always trained anytime you have any patient, no matter what their issue, there's a mental health component that we had to address. So nurses are very used to it. And it's something that certainly the nurse in the clinic is going to be used to that as well, and being able to connect those folks with the best resources. It's fantastic that you're doing that.
Well, so I loved having somebody like you around especially when you've got a lot of employees, and we would have accidents inevitably in manufacturing. And so the one time there was an accident, and the guy smelled like alcohol. And so the supervisor, I'm glad, he was following sort of our reasonable suspicion checklist or whatever. And he was like, I think this guy's drunk. And as part of the process, we would call the nurse, and she was like, no, don't accuse him of that. Like, we'll do all the tests, and I'll be in, it's 2 a.m., I'll be in. But don't accuse him. What if he has diabetes? And
That's it.
his breath smelled like really sweet, and turns out he had
That's what it was.
diabetes, and he didn't know.
Yeah.
And there
but
are
if she
other
wasn't
mouth-
on our team,
Yeah.
That's right.
and that's why even if you can't afford it, you don't have enough employees to bring a registered nurse on staff, having a trusted clinical advisor in your community and that established relationship already when you're in a sticky situation like that, you should have somebody clinical that you can call and say, hey, walk me through, I'm going to walk you through what we've noticed, physical symptoms, behavioral symptoms deviating from the norm. But that was really, really helpful, and the guy got medical help.
Well, thank goodness, right?
That was Thank goodness. He probably didn't even know he had that.
He didn't know.
Because that could have been my patient that I described to you, my employee who
Yeah.
basically stumbled into the ER and doesn't even remember. That was his scenario. Didn't even go check. So it was a new diagnosis and just kept getting sicker and sicker.
Yeah. So tell us about MMA's got a new kind of like data optimization tool, 360, Wellness 360?
Workers Health 360.
Workers Health 360.
Yes. So MMA has been working on this solution for over 4 years. Actually, we just launched it this past spring. And I am so excited because for me personally, this is a full circle moment. Back in that role when we were working with folks, I would see people coming through the door and they'd be saying or calling me on the phone and saying, oh my gosh, I have to go out and I'm getting my knee replaced, or I'm having some difficulty at work. I know I need to seek some therapy. What do I do? What are my options? My doctor's telling me maybe I need to go out on disability. We'd have those conversations. That person would come back a year later. Now all of a sudden we see some injuries. I know that they have multiple chronic conditions. Are they sick? Are they getting the care that they need to treat those to reduce the risk in the workplace? So I was always seeing these onesie twosies coming through, and I could never put my finger on what does it look like on an aggregate. I see these one-off cases, but how many more of these? And I think one of my favorite stories to share is that I had an employee who came to us, and by the time he reached me, he had gone through several nurses and worked with them. He had 8 workers' comp claims in over 2 years.
Oh, wow.
Now
That's
a lot, right?
That's a lot.
So, but he was always very compliant, a great guy to work with, always went and got the care that he needed. And this is where the flags weren't really coming up. He never went out on leave. He was always staying at work. And he was always telling me and all the other nurses he needed to be at work so that he couldn't afford to have that reduced compensation.
Right.
Workers' comp pays a percentage of your
Yep.
salary. So as I was working with him, he happened to send me paperwork from his physician that was also going to the carrier that was managing the work comp claims. And I saw that his body mass index, BMI, was 35, which means he was overweight. Now this person's job was essentially putting a 100-pound cable over his shoulder, climbing up a 10-foot ladder and crawling through a tunnel every single day. So no wonder he was having all those comp claims. And as my conversation had to change with him, and I had to start saying, okay, I knew I had to ask the right questions, which is, when was the last time that you were at a doctor? When did you go and have your physical? And he said, oh my God, Nurse Kate, I haven't been since I've started here at this job. And that was 4 years. So now I'm putting the pieces together that here's somebody who, from my health plan data, he's popping up, and my consultants have been telling us, hey, you've got a certain percentage of folks who are what we call a $0 claimant. They have 0 touch points with their physician.
Like if never, even had a flu shot.
Nothing, right.
Yeah,
There's
no
nothing
activity.
coming through the claims because they're not taking any activity to be preventative in their own care. So I now, of course, I'm saying, how many more of them exist? And so I wanted as my goal, I actually put this on my professional development plan about 12 years ago now, but I said, I am going to work with my consultants, I'm going to work with our carriers. I want somebody to build a solution where we can pull all this data in and we can sort it by employee to understand what that true impact of that health is. Because I was getting reports from workers' comp and seeing 250 individuals being injured. Okay, my first question as a nurse is, how healthy are these employees?
Right.
And nobody could tell me. Although I might be having one-off conversations, and the nurse case manager for workers' comp is saying, well, you know, they do have chronic conditions, they have diabetes. So that's the reason why they need to go out on a leave rather than staying in, even though it's just minor injury and getting sutures or stitches. So this person, because it was on their ankle, they needed to go out and be taken out of work. So that information could have fed into a larger conversation, which is exactly where we are today. And that's what Marsh McLennan has built. And we are taking in all the data from the health plan, medical, pharmacy, disability, leave, workers' compensation, putting that all in to then sort it by employee so that we can start to understand what that impact is for those employees who are being injured, whether they're going out on disability, how much chronic conditions are actually impacting that leave of absence compared to those people who maybe don't have chronic conditions and going out for similar type of surgeries or absences.
It's funny, like when you work with smaller mid-sized companies, there's not a lot of leave, especially like with white-collar remote jobs. There's just, but when you're in manufacturing and logistics and healthcare, I mean, like leave management is a giant piece of
I mean, the amount of like people, I worked in retail for so many years, but a company of 80,000, so it was big, and each location had hundreds and hundreds. I mean, I had people on leave all the time, and then I did one today. I'm like, gosh, I haven't processed a leave for anything in several years, you know, and
That's
I just thought
interesting.
of the amount of leave.
That's so funny because I'm doing that right this
It's
week
just,
too.
yeah,
Really weird.
it just doesn't happen
doesn't
as
happen as much.
often.
But I can see this tool being super, super helpful for
Yeah.
logistics companies. So if you're doing trucking or you're sitting a lot, you're standing a lot, you push, pull, lean over, bend,
Manufacturing, construction,
construction.
all of those jobs that have a lot of manual.
Yeah.
You know,
Yeah.
it's those are the jobs that are typically the industry where we're going to see the highest results from that information.
Yeah.
I remember a situation at Nordstrom. We had a pretty centralized team that did our risk management, so they processed claims. So that team, they kind of tracked it all corporately, right? But we had, 120 full price locations, 200 and some off price locations. So a lot of different locations when employees were going out. So we had all the alterations teams, the average age of our alterations employee was probably 70. There was a very veteran team of individuals in every location, but all of a sudden, like, we hit this year and it just was like all these rotator cuff, because the ones that did the pressing, that's all they did all day. The
repetitive motion,
presser was like this all day,
Yeah.
up and down.
Yeah.
So it was the
Oh,
sewer, because they were different positions. So it was the sewer presser position. It's like finally someone in risk kind of pulled it all together and just happened to get more and more of these. Yeah, we ended up ordering all different machines. We started replacing machines, so it was a little bit better. But it's just if that person in risk hadn't kind of tied all those different claims together, and we didn't have regional saying, hey, I got another employee in another location that's going out on leave. And these were long leaves and long recovery times for that specific injury.
And that's
and hard to replace jobs.
Very specific skill
very
set.
specific skill set.
Yeah. Pumping
Right,
those out.
that's right.
Yeah.
And that's exactly what we plan on doing.
Exactly.
Because think about, especially in HR, right? As you're sitting there in HR. Now, I was a very unique skill set in our team, right? Because we saw all employees and we covered both the leave as well as disability and workers' compensation. So we did see it all. But most often, in a lot of companies, they basically do not see the risk management side of the house.
Right.
And that's conversations that we have when we're sitting with our clients. We're asking them, what's going on with risk management? Who's that person? Do we have the right people at the table? Because that conversation is so incredibly important for people to understand. Certainly C-suite, and we're seeing a lot more of the C-suite sitting at the table in these conversations that we're having, because healthcare is expensive, very expensive. We have people who are living longer, working longer. They have a lot more complex conditions. Certainly the obesity issue, people are getting, larger as well, and that brings a lot of health issues there. So when you're trying to piece all of this together, you often don't have the right people that are sitting at the table to really understand or contribute that part of the conversation.
Yeah.
And that's what we'll be able to do, is we're going to have the business insurance side and the employee health and benefits side sitting at the table, HR, risk management, safety. Those folks are going to be at that table to have the conversation so they can understand it. And it's really exciting to see.
This will save a lot on renewal costs because you're proactively identifying broad stroke problems and then going and providing these employees with resources to go get well. And so then, because all those claims are what really jack up the renewal, prices. You're at double digits. if you've got a lot of claims and a lot of sick people. So yeah, that's why the CEOs are at the table, right? Because they
absolutely.
they don't want to see, they know they're going to get an increase, but if I could minimize my increase, that'd be great.
And I used to have the question, I would bring a solution that my employee health and benefits, our consultants would say, you really need to put this in place. You've got a lot of diabetes. You've been watching it increase now for 3 years. We know that folks are type A personalities. They're not doing what they should be doing to manage their conditions. We need to put a vendor in place like a Livongo or something that's going to help them manage their own conditions, and it will help reduce some of that risk, hopefully some of that spend, and improve your productivity. So when I would then turn around internally and go and talk with my CHRO saying, here's what we have, the first question that the C-suite always asked me was, well, if you put this in place, can we show that it actually impacts your workers' compensation? And it made sense that it should, right? It was logical, but I couldn't prove it through the data. And that's what we can do today.
Because it wasn't all tied together yet.
That's right.
Yeah.
So this is what's so exciting about this tool is that we do this today on the employee health and benefits side, is we can put solutions in place and we can show that cohort or that group that could have used it but did not, a certain solution, and those who did use it and what those healthcare costs are and compare them. So they can have that conversation internally to see that there's a return on investment in that program. They've got healthier people, it's money worth spent, and that we're going to continue it, or is it not working? Do we need to reassess and maybe consider a different type of strategy?
Yeah, I think that's great. I mean, I think in general, I don't know. I mean, as a director, for the amount of employees that I had, I really did not have any insight into the usage of healthcare. I mean, we didn't get a lot of that from a reporting, right? There were so many things to worry about, so many metrics. It just felt like at one point we had our own team that managed all the benefit service center, we called them. And then I think 3 years before I left, we outsourced it to a third party, and it became even less a topic, that it came to us. But I just don't remember ever getting even how many people are actually going in for, we used to call it like the biometric screening. You could get $300 towards your premium every year if you did like these couple of things, right? And that way at least people were going and getting their glucose tested every year and their cholesterol. But I'm like, I don't remember ever seeing a report of like how many people did that and how can we help promote it.
Yeah, the promotion.
And we were such a trim team too. We didn't have a lot of time to go around checking up on people's benefits and their own health. But I just think that, the amount of people that would be out on leave or injured, and we weren't looking at it through that lens, right? And thinking like if we did these things, we would ensure our people are here, they feel good, they're ready to work. We just weren't tying it all together, I think.
And that's really,
that tool is going to be.
It is, because as I work with clients, that's the conversation we're going to have is, first of all, those reports that we got, you have to know how to read them. You have to know what questions to ask. How do they define engaged or enrolled? Because sometimes they'll take that certain vendors are going to do what's in their best interest, right? And be able to get out there and their product is a good product, they feel, and they're going to stand behind it. But the way they report it, they want to, shine the positive light on it. And I think the best thing to do is have that conversation about how it's being defined. And let's take this information and then try to understand how we're going to use that report and align it so that nomenclature is the same. Because that was where I think came to a standstill at every point that I was trying to turn and trying to prove what I knew was happening out there, because I did not have reporting that was describing things the same. They were all defined differently. Eligibility was not the same across all reports. The reporting period was different. Nomenclature is different. So that's why bringing it all into this one data warehouse that we use, have them integrated, it's all going to have that alignment so that people can now start to understand exactly what that impact is across their entire dashboard.
Awesome.
I miss dashboards and data and analytics. We work with such like small businesses. Some of them, I mean, I have some that I work with that have, specialized tools for their industry, but I miss having just this like data analytics system that I can like build things in.
And look at, yep.
I know.
Well, let's look for ways to use this 360 tool.
Yeah. Great.
Okay, let's take a couple of minutes and talk about an audience rating. How about that?
Yeah.
Love it.
Let's do it. What do you got?
All right. Well, a big topic lately is, of course, working from home and just all the things go along with that, being forced to come back to the office with some regularity or whatever. So here's one. Oh, it's kind of a little bit sad that they have to worry about this. Working from home with kids in the background. 25% of the roles being on meetings. My children are very used to me as I've been a remote sales rep for years. I now have a new employer and have not discussed this and have concerns if the kids are making noise in the background as I have pretty open floor plan and while they are there and noise travels. Do you think my employer will bring this up or have an issue working from home?
Yeah, I mean, I would say if it's a concern and it's something like keeping this woman, and I know it's a woman because I read it, so up at night. I think I cut some of it out, and I remember the comment was made like, my husband's never once worried about this with his. It's like she feels the weight of that with her employer, yet he's working from home and he doesn't feel that way. So I thought that was an interesting aspect too. But I said if she's worried about it and she thinks it's going to cause concern, then I would say get in front of it and maybe say, hey, I want this to be, I want to make everyone aware my kids are at home, but clearly she's concerned that there's going to be some pushback that her kids are at home. And my guess, because we hear it, is that, well, how can you focus if your kids are at home? How are you focused on work and blah, blah, blah. We get all of that. And again, it sounds like our kids are used to it, but they are there and they're in the background. And,
how do you feel about kids being home while you're supposed to be working?
I might have a different opinion.
Yeah.
I think it's really hard to do both well.
Yeah.
If you're really focused on caretaking and then also doing your job, I don't know. I did it a lot, and I was a single mom, and it is hard because you felt like you weren't doing one well enough.
You're
and
torn.
You needed to focus. And so what I thought was a good idea was to be up front, tell people right away, like, hey, this is what's happening, because I think if you own it first, that's going to help. But then certain times when I knew that I really couldn't focus on my kids and I really needed to focus on this, I would get like a little babysitter.
That's a good idea.
Like they have those
That's a good
drop-in
idea.
centers. So maybe some people, maybe it's cost prohibitive,
Yeah.
but it just made me less stressed. And then I did a better job, and then I could clock out of work and then be a full-time mom again.
Yeah, it probably depends on the age of the kids, right? I don't know that, if you had a baby that is crying, and that might be more
someone's
challenging
crawling
if
on
you
you.
had
Oh my God.
a 12-year-old, right, who's doing their homework at the
And they can-
table on their
Right.
own, or so I don't know. I try not to speak about anything around kids so I don't get flack as someone who doesn't have children myself.
Canceled.
Exactly. Well, I mean, I'm of the opinion of like, deal with it. People can be productive. They figure out how to live their lives with children and show up to work and manage lots of different things. And my question always goes back to, is the work getting done? How often
Bottom
is
line.
this coming
Exactly.
in? If this is one time, I mean, she said 25% she's on calls. That's 25 out of 100.
She can figure that
It's
out.
like, okay, so 1.5 to 2 hours of your day, you're on calls. Well, you got to get some regiment. You got to schedule those calls at the time where the baby's taking the nap. I don't know.
Or they're at school.
Or they're
Right.
at school, right? So you may have to structure your day differently. It may mean that you
Be
have to
flexible.
catch up for an hour before you got to catch up on your emails before the kids wake up, right? If you're super distracted. So
I think you
I
hit on
think
it.
it's
schedule it.
you got to schedule out. You got to make it work.
Work
Sounds
is
like
work
she's a
and
pretty,
someone's paying you, though.
right. So you
so-
got to get the work done.
Like, I don't pay people for fun. Like, I want you to work. I don't want you
Oh,
to.
you're the one that's like, how are you?
I'm not trying to be cutting hot dogs while I'm on a Zoom with my boss.
Well, listen, I have a little dog. She can be pretty distracting. Sometimes I just put her on my lap for Zoom calls.
Yeah, but nobody
cares.
notices.
She's pretty cute. So
It just
nobody cares.
depends. I think the one thing that bothered me about the write-in was like she hadn't talked to her new boss
Yeah,
about it.
I feel like you gotta put it out
Yeah.
there.
And
That's the
especially
thing
she
to
said
talk
that
about
it
before
went
taking the
well,
job.
So just say, hey, this has gone great. This
Yeah.
is what I'm
Right.
used to.
It's working.
I think you have to be
Selling
upfront. You have a work from home job. It's no longer COVID where everyone is working from home and the kids are at home as well. And there was a lot of empathy around that. We're not in that same environment. So it's time to transition back into the environment where people are used to the kids being at school and people are sometimes in offices, sometimes not. So I think you got to be upfront about it.
Yeah, you got to be upfront. Never want to be sneaky because then you feel guilty.
No.
Yeah.
We already have mom guilt, so it's like we don't want to do. We don't
Just
want
be
to
add to it, right?
Yeah,
Yeah.
and it sounds like maybe that's what she's kind of feeling
And
a little bit
if
too.
it's cost prohibitive, switch with somebody else in the neighborhood. I mean, you guys.
That's a good idea.
That's a good idea.
Yeah, that's a
We're
very
women.
good
It's like,
idea.
hey, on
Yeah.
Thursday at 9 to 11, I've got these meetings. I
Right.
cannot be distracted.
And I'll take
Yeah,
your
or-
kids
yeah.
during that time.
Yeah, it sounds like the
absolutely.
husband's at home
Easy.
too,
It's a
so you
great
gotta
idea.
take the calls at opposite times and schedule differently.
You need to reevaluate your relationship with your husband. On that note,
Hopefully he helps.
It was always, I always did feel so guilty because I'm like, shh, you
Yeah,
know, and
it's the
like,
mom
God,
guilt.
What a horrible mom I was. I was like, stop talking, you know, it's like, God almighty. So that's why it was like the drop-in daycare for 2 hours, come back.
Good idea.
all right. Any closing thoughts? Things that you want small, mid-sized, and large businesses that might be listening right now to know about MMA and what you've got going on there.
Oh my gosh. Well, I think biggest value is that we have an absolutely phenomenal team model where we have nurses who work with our clients, and we are led by a fantastic chief medical officer who is just right there alongside us. So we are constantly looking at research studies as nurses, certainly health management consultants, our population health specialists. So we tap into each other and work very closely. And then our third prong or third leg of the stool is data analysts. And the three of us work very closely to understand what those clinical analytics are telling us, what it says for their risk and spend for the future, and then what strategies we can put around that. So it's a great model, lots of wonderful, wonderful people who are doing phenomenal work every day.
Awesome. Well, we love getting guests like Kate in front of our audience, and I want to thank you for being here.
Thank you for having me.
Thanks a lot.
Appreciate
Thank
it.
you very much.
Thank you.
And, you know, we are HR people, but we're not your HR people unless you call us. So make sure you reach out to Leap HR Group. We're on all the socials. We've got funny TikToks out there, and we'd love to hear from you. LeapHRGroup.com. Thanks for tuning in. Make sure you hit subscribe. We'll see you next time.